to become a nurse was after doing CNA work in high school and working in the nursing home with the patients there. The patients in the hospital, they often express their concern with the way they were treated. And one patient specifically told me that they really enjoyed when the students came to the nursing home because that was the best care they received while at the nursing home. So that touched me, in addition to the fact my grandmother is also a nurse. So that kind of pushed along my decision to go to nursing school and become a registered nurse.
Well, I chose to become a nurse when I was in the Navy, and I was a hospital corpsman. Kind of got pushed into that area, that specialty, and started working in the hospitals and really found it to be enjoyable. I didn't find nursing to be like actual work. I enjoyed helping people, and that's sort of what triggered me to become a nurse, was just enjoying helping people. I think the way you treated as a nurse depends on what setting you're working in. Before I worked in school nursing.
The cafeteria in about 5 minutes.
About that. Before I worked in school nursing, I did work at the hospital. It was a little more difficult there, just with the medical profession and the nursing profession. Sometimes we're at odds what our goals are. Nurses are more about taking care of the patient in a holistic fashion, and the doctors are not always that kind to us, or don't treat our opinions as professionals. But here in this setting, I find that we practice independently, and our opinions are more valued.
No, I do not believe I'm invisible to Bowie High School. We are a valued member of the team here at the school, and we're all working towards the same common goal, which is keeping students in school. I do find that the staff here are very supportive with everything that we do here in the health room, and ensure that we have what we need, or particular people that we need to talk to make sure that we reach that common goal.
No, I don't think it's easier being a nurse than a doctor. I think that the professions have their own separate focuses and goals, and certainly, the doctors. There are doctors that go to school for 20 years to reach whatever specialty it is that they want to specialize in. Then we have some nurses who do the same, specialize in different areas. So I would just say I wouldn't say it's easier. I just think we have a different focus.
At one point in school, I did consider becoming a doctor, but as Ms. Suchi mentioned before, that nurses and doctors have two completely different focuses. And I felt like, being a physician or a doctor, it felt impersonal. Like I couldn't really connect with my patients the way I wanted it to, because there's a certain demeanor that you have to carry as a doctor versus a nurse, where you can be more caring and you can be more personable with your patients. And I like that more about nursing, than to even consider being a doctor.
So apparently, to the nurses at Bowie High School, they don't feel that they're invisible, but they feel that nurses as a whole in a community aren't invisible. And I noticed that they felt that this project was very important to the society, and were glad that I did this project.
Let me tell you what a nigga told me. Expect nothing, don't nobody owe me. Grinding for the chick, I hustle like Ginobili. So if you talking money, you gon' have to show me. I'ma turn up for a chick, tryna pull up